as is being seen nationally, we are continuing to see an increase in BA2 over time here in Wisconsin. And I don't have the specific numbers. I think it's in, somewhere in the 60 to 70% range at this point in time. The best source of that data, of course, is the Wisconsin State Laboratory of Hygiene website, where they have they're pulling live data out of WisEye, which is the system for tracking that data nationally. So we are continuing to watch that closely. As you've likely noted, we are seeing some increase in case numbers over the past couple weeks. And that's likely, in some ways attributed to the increased circulation of BA2. And I think it's a good opportunity to remind people that COVID is still with us, and it's important to continue to take precautions, appropriate precautions based on the community level in your area. And for most of Wisconsin, that is a low community level. And the most important thing that we really are recommending for communities that are at that low level is to make sure people are getting vaccinated. There certainly have been criticisms of the new community level approach. I think as we look at them, I think what's most important is that it really is incorporating that hospital metric. And we're not just looking at case counts. Case counts, of course, are important. But the other piece that's really important here as we think about our ability to manage the pandemic is to think about hospital capacity and the ability of our hospitals to continue to provide care for those who are most ill. So the community levels are really helpful in terms of adding in that metric. And I think the community levels help us to emphasize the importance of people continuing to take the appropriate preventative measures for themselves, including getting those vaccinations. And, as we move from green to yellow, of course, then some additional recommendations come in place in terms of masking for people who might be immune compromised or are around people who are at higher risk. And of course, then we move to the orange, the higher level, which does include still recommendations for masking. So I think the community levels, while they are a different approach, there's really some added benefit in terms of thinking about our capacity to manage those who are sickest and make sure we have that hospital capacity available.